Well, welcome everybody. My name is Nasser Ismail, and I like to describe myself as a recovering humanitarian working in philanthropy. I want to welcome this great panel that we have with us today, but I want to welcome all of you who are joining us by virtue of the Interaction Annual Forum. I'm so delighted to be speaking virtually to all of you with these experts on a topic that I think is so critical to the work that we do, but also so very misunderstood. We're talking about duty of care, how it's described, how it's supported, how it's prioritized or not, and overall how it's discussed in the places that we work and for the organizations that we work for who are charged to deliver critical aid to the people around the world. So I might imagine that when you think about this topic, you think about particularly the definition. On a basic level, we all know, or maybe it's new to some of you, that duty of care, this topic that we're going to be having a discussion together with our colleagues on the panel today, refers to the basic legal responsibility that organizations have and the staff within them to do no harm to the people that they support, employ, and work with. That is a very legal definition. It carries within it risk, operational jargon, but it also can be applied, as all of us know, in a variety of ways, depending on the specific issue, the lens, the sector, and the organization concerned. So we plan to break that conversation down to a more human discussion, to humanize the term. And we have together with us today some incredible people that I respect in our sector who will be able to do that, and I will be happy to moderate. It's going to be a discussion that both moves through the term and how it's understood, but also brings in perspectives like how do we look at this now in times of COVID? How do we look at it from all the lessons we've learned, let's say from Ebola? And how do we walk away at the end of this 45 to an hour discussion with some meaningful conversation, but also some guidance? What can we do better to essentially serve the greatest assets that we have, which is our people? I'm joined today by Jennifer Poydats, who is currently serving as the Vice President of the Humanitarian Response at Catholic Relief Services. Thank you, Jennifer. We also have Dr. Miranda Navoma Doe joining us from Goma. She serves as the Emergency Coordinator for IRC. So I'm really honored for her presence, for her time, but also for her unique perspective. And finally on your screen is Melissa Pitotti, a humanitarian, a friend of mine, someone I've worked with greatly in the last few years, who joins us from Geneva and is an advisor for the CHS Alliance. And maybe let me ask all of you, starting with Jennifer, then Mimi, then Melissa, why is this topic so important for you? Why is it important for your organization? Jennifer, can I start with you on that question?
Sure, and thanks so much, Nasra. So I think for Catholic Relief Services, and I'll shorten it to CRS, at the agency level, the reason this topic is so important is because our people are our most important asset. And I think just to be clear, by people I'm referring not only to CRS staff, but also to the staff of our local and national partners, in the volunteer networks that are more often than not really the ones on the front line. Maybe more specifically, as a humanitarian director, I think duty of care, of course, is really front of mind. I think, as we know, that if we don't take care of ourselves, we're not at our best to support others who are at their most vulnerable. So I think it's often in humanitarian context that are the biggest test for duty of care. And then if we look at the arrival of that pandemic, we're in a situation where we're really adding a layer of complexity and risk that requires further attention. Maybe one other thing is that I think for CRS, we quickly came to the realization in the early days of the pandemic that there was really a need to focus on all our staff. So when we often kind of focus on those staff in the field, we really had to look at our staff in headquarters as well. Those were, more and more people working remotely, people with families, single people. So it really brought that kind of even the need for greater attention. And I'll let others jump in.
Thank you very much, Nasra, for that question. This topic of duty of care is very, very important to me because being a frontline worker, there is nothing you can achieve in the field, from me to my staff or to my beneficiaries, both international and local staff, without having some high level of duty of care that you have to implement. And from the organization point of view, I serve the IRC, International Rescue Committee. And when you look at the motto of the IRC, what does it say? From harm to safety. And duty of care entails do no harm. So you see, from their own logo, it is telling us we should ensure we do no harm. How can we avoid not doing harm if we don't have some duty of care from the staffs to the local communities? So you see, it's a very, very important topic. And we've been dealing, in the past 2 years, I've been dealing with Ebola, and there come COVID. So you see, COVID, being a frontline staff, I'm always aware of duty of care because they remind you of duty of care. My organization, like every other organization, always struggle with duty of care because it's quite large. But when COVID came, we realized, there is duty of care that entails everyone, just like Jennifer has presented. So when you look at it from that perspective, it is very, very important.
Thank you so much. And I so want to just applaud you because the language we use is so important. So frontline worker, I want to come back to that. But let me ask Melissa as well for her perspective in answering the question of why is this so important to you?
So why is duty of care so important to me? For me, it's very personal. A few years ago, I personally experienced a burnout. I did not address it, and I eventually experienced a depression that put me out of work for several months. And when I wrote about my experience on social media, I got hundreds of responses from fellow humanitarians in all lines of work, frontline workers, headquarters workers, all regions. They're also struggling, and this is before COVID. With the advent of COVID, like Jennifer said, it affects everyone, maybe in different ways, maybe disproportionately to certain people that have certain characteristics or backgrounds. But for me, it's personal. If we don't fulfill our duty of care, which is not optional, it is our duty, we will not be working in a way that is sustainable, in a way that is fair, and ultimately in a way that is effective for the people that we serve. So for me, it's crucial that we as humanitarians are acting humanitarian when it comes to our own people as well as those that we serve on the outside.
Thank you, Melissa. Jennifer, from where you sit as a senior leader in your organization, and also particularly somebody who travels and is able to talk to the same community and people that Mimi's talking about, not just staff inside organizations, but those outside, those communities. How do you look at it from an organizational leadership perspective, the policy, the standards?
I think first to acknowledge in terms of kind of as a sector, I think we should appreciate, even though we all know we need to do more, that there was quite an early focus on duty of care from the beginning of the pandemic by many organizations, and also at the level of the ISC. And also to note that even before, and many of you have probably seen this, the ISC minimum standards on duty of care were released at the end of November, many agencies had already put measures in place to support the safety and well-being of their staff, and of course with a parallel focus on ensuring the safety of affected communities. I think for CRS, we updated our leave policies. We confirmed to staff that we would cover the cost of local insurance plans, if they don't cover the care related to COVID, added wellness days. I mean, there and then specifically on my team, in addition to redoing all our guidance and tools, we worked with health colleagues on training materials, and also starting to deprioritize tasks, or taking, or giving staff the ability to take up part-time work, or taking on additional staff or consultants to address workload. So I think there was a lot going on there that we can appreciate. At the same time, I think we really saw this as kind of a crisis within a crisis, and that the pandemic only highlighted the challenges that we face as a sector to really fully ensure a duty of care. And more specifically, I want to highlight for those local and national organizations that we often partner with. And that even though, I think we all appreciated and were supportive of the ISC guidelines and found it very relevant, and went back to look at it, it was really silent, on the issue of our commitments to support duty of care for our local implementing partners. And I think we really still struggle to take the time to fully understand the risks that our local partners face, to understand, they're different from our own, and to really help them put those mitigation measures in place. And I think there's this links back to our efforts within our commitments to the Grand Bargain under the localization work stream. And that oftentimes, unfortunately, the funding flows to local organizations often exclude ICR, which is often those resources that we use that draw on for duty of care related costs and medical or staff training, robust, leave policies, psychosocial support. And so budgets are often not sufficient in terms of direct cost, and can often push a small agency to prioritize. So, I can't buy PPE for my staff because I have to cover implementation cost. So I really think these are things that have highlighted the struggles that we're already facing and that we really need to work on, and really to, kind of maybe more broadly, really push ourselves to really make progress on, risk sharing, as opposed to what we're often seeing is not really understanding the risk at our partner level, or actually, unfortunately, transferring those risks.
Absolutely. Often, I think what you're saying makes me think of how unisolated the localization Grand Bargain commitments and discussions are from particularly showing up in the way that they did in COVID. Having a lot of our international staff be able to prioritize their well-being, the duty of care of the organization, to recognize that, and the differences between those two types of staff that we have, types of partners. And, them being pulled out from one country, meaning now the frontline staff, the local actors are facing a greater threat. So I deeply appreciate the way you tease that together. Jennifer, I want to just come back to you on one particular thing you said, and then turn it over to Mimi. You said, this is a crisis within a crisis. And I wonder, from within the organization, you've taken some actionable steps considering the guidance, but among your peers at your level, was the discussion similar? Were other organizations having similar questions, doubts, or did it seem like everybody was just able to address it as often as possible in the times that we're in?
Yeah, no, it was. I think it was definitely top of mind across peer agencies and discussions within most of the calls with other humanitarian directors, the calls that Interaction was convening on COVID-19, and I think there was a lot of opportunity to learn from each other, and I think especially on those points where you would get kind of what I mentioned earlier about it's all our staff, where we get kind of focused on a certain, it's people with children when we're looking at kind of certain category, or it's single people who are struggling the most. And one of the things I found, within my team, these are people who are used to being on the front line, and having that contact with communities that we're working with and responding to the needs of, and to see how that really impacted, their inability to move, and how that really affected them, and their sense of feeling like they weren't being productive, they weren't being as effective. So I think there was a lot of learning from each other within those discussions, and kind of helped you to see from other vantage points, like where we might have gaps and how those might be addressed.
Excellent, thank you. Mimi, I know you're hearing all of this, and I would say from Among all of us, you're the most proximate to community, to local actors, and where you are, where you're located. How do you both respond to, maybe think through what Jennifer and Melissa have shared, from burnout to this crisis within a crisis, from where you are? What, if any, have you seen lessons from Ebola to COVID, from the IRC perspective, from your perspective as an epidemiologist? I want to turn over to you on that.
Thank you once more, Nasra. Yeah, very interesting. The first advantage was running an Ebola epidemic. So duty of care automatically was paramount for us, the frontline workers. So we were quite conscious of the different levels of duty of care. Just like Jennifer mentioned, we have different programs from child protection to support of health facilities and to risk communication and community engagement for the IRC. So when you look at all these different pillars, we were all acting directly with the communities, partnering with different partners. You see, so duty of care was quite paramount. So when COVID came again, we kind of realized, oh, it's time to take a step back because the transmission, we're conscious. Ebola, you also have the preventive measures, but we didn't have to go around with masks and things like that. When COVID now came, it was a moment we sat back and said, oh, now this is the transmission is quite airborne. So we started putting different strategies in place to protect it. First of all, our frontline workers, our staffs, everyone, and some of our partners. For example, at the very onset, when we put measures to limit contamination, we provided masks to communities. So this was our own measure. Yes, with funding, organizations run with funds. You can't really have funding to put in place measures like you would put for your own staff, to put on the partners. But for the staff, IRC came up with very amazing policies, like our staff that used to go by public transport, which is another means, we provide them means of using organizational vehicle to pick them up from certain points, take them to, to their different activities. Those were just essential staff. The non-essential staffs, we kind of promoted them to work from home so that we limit infection while we're thinking through how we position staff with the distancing and everything. So you see, we kind of, but when it went to our partners, we can't put the same options because we are just partnering with them. But however, we also ensure we provide them, we work with providing personal equipment for Ebola. So it was just adding a bit of this equipment to our partners, which we really ensure we cover those basic equipments that they really needed, even though we're heading for Ebola, but we were quite relaxed and they could still share for both situations. So the organization took it quite seriously. It didn't come like a shock. We were already used to PPEs, we were used to, except the mask. The only thing that was different for us was the mask. But however, it wasn't also easy as much as you try to establish duty of care. When you look at your partners going down to your beneficiaries, it becomes very, very complex and cumbersome for us as an organization. And I, being in the field frontline and being a coordinator in the field in the most recent epidemic, it was quite tricky because how do you get the community to trust you? You were talking about Ebola, telling them this is how you behave. All of a sudden, you have to convince them that you have to put on masks, and you are trying to talk about it. Also dangerous, it has been easy for us that are managing both because people that have been to Congo, West Africa, what Ebola looks like. It's something you don't want to talk about, and then now you have the community trying to get everyone, be it the partners, to really believe in you, and then your strategy of isolation for them to respect the different procedures. So it's been a long wait, but with much experience that the IRC has gotten, and as a leader in the field, we try to talk through, convince the people, try to even get into hard to reach areas, something that previously we might just relax and think it's easy, but ensure this time around that whatever message we were sharing linking Ebola, we always added COVID.
And what I appreciate and everything that you said is just obviously the complexity, the deep complexity of the issue from the local offices that you all have, but particularly in that even as best as you could to draw the lessons from Ebola, which you rightly say has helped bring a perspective to you that perhaps didn't shock you. But at the same time, the financing that would have allowed you to really put in place those lessons was still a gap. And so we're gonna come back to that in this next round of conversation, because we really also need to talk through if the topic is understood and we appreciate its complexity, what are the organizational barriers, the challenges in the structure. So I appreciate, again, buttressing both the lessons we've learned from from Ebola to try and apply it to COVID, but particularly still struggling with the barrier of financing to the local actors and partners. So I know this is a lot of work that you've been doing, Melissa, on wellness within our very macho humanitarian sector. So I wonder how you bring these two ends together. The technical discussions, as you said, an obligation, right? Not a nice to have, but a must have, versus the real burnout and the risks that each one of us faces.
After I came out with my story and was receiving so much great feedback from people in the sector saying this is something they're struggling with and maybe it could get some more attention, I actually came across the core humanitarian standard guidance, which actually it mentions security and well-being in a commitment. Commitment 8 is really about supporting staff to work effectively and treating them fairly and equitably. And the core standard actually goes into the fact that an agency's duty of care is to national and international staff. It includes looking at mental and physical well-being. It includes avoiding long-term burnout, exhaustion, injury, illness. It talks about a manager's role. I mean, so many of the humanitarians I heard from, they go to bed at night repeating a conversation they had with the boss or with a difficult colleague, even though they're in very stressful environments. It seems that there's something about our workplace culture that's having a lot to do with the stress that we're experiencing. So I just became very curious if it's kind of agreed in our sector that we have this duty of care and that there is something important about well-being. I was curious, why are we seeing humanitarians experience burnout and other mental illness 2 or 3 times higher than a general population, according to research by occupational psychologists like Dr. Liza Jockins. I'm just curious, why is that happening? And in our exploration with the standard underpinning, we started to weave together mental health, people management, and organizational culture together using a lens of care and compassion, since that's kind of why we're here in the first place. We care about affected populations. We're compassionate. We want to help alleviate suffering. So why is this all happening? And the answers coming out they could surprise you, maybe, or maybe you would be not surprised. For me, I was very surprised. But to your first question, what is it showing up in our colleagues if they're experiencing a burnout? I go to the World Health Organization's involvement in the ICD-11, the International Categorization of Disease number 11, that talks about burnout is a result of chronic stress that is poorly managed at work. It's very specific to work. And it manifests in 3 ways. First, utter exhaustion. You are very tired. Number 2, cynicism. You become very negative. And number 3, you lose your, what they call professional efficacy. This is your effectiveness at work. In my case, I was making very simple mistakes. Even just setting up a meeting, I would confuse the time. I was becoming very cynical in meetings with my colleagues. I would become very mean and negative. We already talked about this. And I was exhausted. Partly that's because of work, but partly that was because I had small children. But the fact is, these 3 things come together. I think if you do a little awareness session with yourself or just ask a colleague, how are you doing? I think this comes up a lot. And it could be a sign of other deeper things going on. But the idea of self-awareness and paying attention comes up as a theme again and again in the work we're doing in the core humanitarian framework competency. Self-awareness and awareness of these things is important. Now, the 6 risk factors, and I'll stop. If you look at the risk factors, and it came up with the things that other panelists were talking about. Number 1 is your workload. In the humanitarian sector, you hear things, I'm stretched, I'm too busy, I can't keep up. The campaign I was involved with earlier, less paper, more aid, is about this. We're becoming so bureaucratic. There's so many compliance requirements, we can't keep up. So your workload is a big risk factor. Your sense of fairness is a big risk factor. Do you feel that your work tasks are being disseminated fairly among colleagues? Do you feel that the decisions being made are fair? This is something that's very important to consider going forward. What else is a risk factor? I think we talk a lot about recognition. Are you getting credit for the work you're doing? I mean, in the humanitarians, we come into it, we're to give to others, but it's still nice to hear from a colleague, great work.
Right.
What you did the other week was excellent. But a lot of times in our sector, it's a lot of negativity, like that wasn't perfect. And there's a lady named Gemma Huldy who's done a lot of research on perfectionism in the humanitarian sector and what would it look like if we become more vulnerable as humanitarians and say, we're not perfect, we're trying to be better. And we're trying to do better, but we have to be better and recognize that we make some mistakes along the way. So those are just some examples of risk factors that we have in our sector. And they just come up again and again. And it leads me to question the ways that we work the ways that we're working. A lot of it, we have to just reply to the demand, but could there be ways that are more human-centered or more people-centered that could be more sustainable in the long run?
Absolutely. I take that as even, just as you were telling your story, I mean, I can tick off a number of those at times that I felt overwhelmed, stressed. I mean, we take for granted the humanitarian element of that responsibility we put on ourselves. And so imagine if, I'm an employee, you're my employer, and I'm having that conversation. What is the enabling environment to be able to have that discussion amongst all of the wonderful things that we do, meeting the donor requirements, meeting our organizational requirements. So I wonder what, if this is so critical and this is so, baked into how well we do. You talked about efficacy, how well we do for the communities that we love by taking care of ourselves and the organization taking care of its staff to do no harm as a minimum, but then to be able to thrive and be well. You start to ask yourself different questions.
Sometimes I think I'm giving my all, but I might just be missing something. Am I missing something? What do my staffs need? How are they? How can I fill in the different gaps? So when I take a look at those, then I also have to look at myself. So the first thing we've seen, you sit there and you are wondering with all the deadlines. You are a frontline worker. Your tasks are the same. They keep mounting. The partners are waiting. The beneficiaries have a complaint. You have to fix all these things at a go. And then I ask myself, is my organization even aware of what I'm going through? Do they really know how much I put in? That's how I question myself. And then I start filtering these things out, and it helps me move forward. But then I take it off me back to my staff and back to my community. So asking these questions. With the mask, with Ebola, it was easier. I could judge physical expression. So it was easy for me to say, you're not all right. Do you want to talk or do you want to take a break? Now with the event of the mask, duty of care has become so complex that myself, I don't even know. I feel a lot of the times I'm missing out on a lot of things. And that's why I always start by, am I missing something? What do they need? Because I can't see that physical expression anymore. So it makes me feel horrible. So I have to look sometimes at the forehead and say, from the tone of the voice, trying to develop other strategies and telling them, what do you need? I'm there for you. But when we look at our workload again, despite me trying to establish a good duty of care, appreciate my staff and say, you can take a break. I will tell you guys what I'm always told. When we take a break, we're not going to have the results. Because an epidemic is real time and we want results like that. Donor, the organization wants results to keep the donor and the beneficiaries telling you we need this. And you can't just give them the basics. You produce something and you are limited. But at the end of the day, a simple thank you helps. A simple appreciation. That's what I've been using. But I realize also, the more I appreciate, the more I say thank you, the more they work.
Right.
So the more they are moving towards burnout.
Yeah.
For the past 2 years, I've had the most amazing humanitarians around me, always ready to give. But when I sit back, I ask, What are we giving ourselves and them in return?
Mhm. They're powerful questions. Those are very powerful questions, Mimi. And I think what I appreciate about how you're working in the structures and the barriers, the questions you're asking of yourself, of the institution, very, very, very powerful. And I want to say, as I'm listening to all of you, I'm grateful to all of you as humanitarians. I want to thank every one of you because we do have to appreciate each other. It does incentivize, it connects us in more ways than we can imagine. I can't ignore that we're all women leaders who are also having this discussion. And so Jennifer, Melissa, I wonder if we just get your feedback on what does this look like as we are also looking at fighting gender inequality, within leadership, outside of leadership, within the humanitarian sector that has been through a number of crises around harm to particular vulnerable communities, women being the center of that. Jennifer, I wonder if you could tease out for us just your thoughts on that question, which I know I didn't tee up before, but also any opportunities that you see despite the organizational barriers on this topic.
Yeah, thanks, Nasra. Maybe just to start with, I think one of the things that I think many of us have seen in terms of progress, at least in terms of recognizing the needs of populations that we're trying to serve, is kind of the increased focus on mental health and psychosocial support. Mm-hmm. And I think many of us were really happy to see that, and also invested more in our ability to support those types of programs. And of course, those issues are often, I would say, not especially for women and girls, but often do occur more in those populations, given the risk that they often face in crises. But I think where we, and I've seen some movement, but I think where we tend to forget that is when it comes to our own staff. So if we've seen increased needs in the communities, which many of our staff are from those communities, then we also need to be sure that we are paying more attention to those needs, the psychosocial needs of our own staff. And I think that's where, in terms of those opportunities, one thing that CRS did, more recently, is that we made sure that we actually had psychosocial support available for all our staff and families in different modalities and different languages. And I really think that's something that was a really positive move for the agency, and very much appreciated by staff in the field, by staff in headquarters, and also, again, trying to extend that to our local partners as well. And I think that's really critical. And this focus on caring for the caregivers. Mm. And again, oftentimes it is women that play that caregiver role in many societies. And so I think just having that added extra attention is really important. And I think it also comes back to why it's difficult, is because it's very individual. I think in the context we're in, we also we have to pay attention as well. And when we talk about the pandemic in a context like South Sudan, people already have like 6 other things that are more stressful.
Right.
They have hunger, they have conflict, they have locusts, they have floods, and we have to adapt to that. And even though we still have to push the preventive measures for COVID, we have to talk about it within their context and what this means, and recognize those other concerns as well, and address them, as to the extent possible as well. So I think those are, some of the, really that focus on psychosocial care, psychosocial first aid, that shouldn't be an afterthought.
Yeah.
It's not if we have the resources, it's that we have to do it where it's needed.
Absolutely. You have to delve into these things and not wait for the right financing, the right context. It's a must. Melissa, I want to come to you because often I know in this discussion we're also so in need of when have we gotten it right? Can you tell us a story that defies the notion that it is too challenging, too personal, too much about wellness and burnout? How do you perhaps get us into reflecting that this is something that we can address, that there is good things that comes out of it once you're able to address and work with the individuals, and obviously adds to the efficacy for that person to have the kind of life that they're proud of, but then also the efficacy that we have to address the issues that we so desperately need in a world that is becoming much, much more crisis oriented.
I'm so inspired by all the great work that's happening in our sector. If you want to look at duty of care specifically, there are people like Christine Williamson from Duty of Care International or others who've been really looking into this. If you want to look at well-being, if you want to look at I'm very interested in organizational culture, people management, etc. There's a lot of great stuff happening that's of value. I think it's not given enough visibility. I don't think it's given enough sustained resources. But there's a lot to celebrate, and I think there's a lot to do in terms of connecting the dots and resourcing the people who are working in these spaces. Because as Mimi said, we don't really know how to strike the right balance. There's a lot of questions because we want to, and in interviews I've done of CEOs recently, it's like we want to be present, stay and deliver. At the same time, we don't want to be asking stuff of our staff that's really not realistic and not appropriate and potentially doing harm. And how do we strike the right balance? So in my mapping, I haven't found a single organization that has figured it out. Okay. But I found really great stories where they're trying to figure out, and they've got this piece that's doing well and this piece. So I would love, and I'm trying to do this with my work, is to give more visibility to some examples of what organizations are doing. And you've already done it on this panel, to my fellow panelists, of things that you've been trying to do. From, for example, equity and support for provision. It's not just for the international staff who deploys, it's for also national staff, it's for also partner staff, it's for everyone. And for that, there seems to be an interest in really investing in a donor dialogue. Can we please start getting the resources that we need to support this? I draw a lot of inspiration. You mentioned, Nasra, the gender issues. I've been looking at feminist organizations. I recently interviewed Julia Sanchez from ActionAid International, because they have in their feminist leadership principles that govern their organization. And I didn't mention this yet in the risk factors, but values alignment is huge. If you come into an organization with really high ideals that you thought your organization was behind, and you see the ways of working are actually out of alignment, that's going to be a risk factor for you. So looking at organizations who explicitly state in their values self-care, collective care, and the gender issues, power, sharing power, looking at how power is disseminated in an organization, how decisions are made. Even those organizations, and there's several organizations that are trying to do this, where the values are there and there's a lot of work to operationalize the values, it requires constant work, constant cultivation. So there seems to be a real appetite. And how can we as a sector compare notes? I've seen this in the guidance from the IASC on minimum standards during COVID. It talks about, let's have joint engagement in changing institutional culture and practice of duty of care. Let's share our expertise, our information, our training. Let's do this kind of a peer learning or peer support, because none of us have figured it out. But it's so important that we are better at this. It's really, we owe it to the people who are involved. So I draw a lot of inspiration from gender experts when it comes there. I draw a lot of inspiration from the discussion around diversity, equity, and inclusion. And here I'm thinking of things like avoid the action bias, where we have to immediately set up a new guidance note and then deploy them. So it's kind of these things. They're just questions to ask, realizing that none of us have figured it out, but it's too important forget.
So please, everybody take note of what every one of these esteemed colleagues are telling us, from questions to actual resources. We're going down to sort of wrapping up, and any final recommendations, any final takeaways that each of you has. We'll start with Mimi, then Jennifer, and then end on Melissa. But what are your final takeaways? What do you want us to commit to, maybe even stop?
I hope our organizations are going to learn something from this. And it's time I'm calling on our donors to permit us have that budget line that can address duty of care. That way, we in future can avoid burnout. When we start seeing signs of burnout, that staff won't be scared. Oh, with COVID, I'm not going to have a job if I say I'm burnt out. When we are aware, we have that money, that possibility of covering gaps for staffs moving towards burnout. Because once burnout is costlier than preventing burnout. It was amazing knowing you guys. For me, that's a take-home knowledge. Donors, we are coming for you guys. Thank you.
Loud and clear. Jennifer.
Wow, yeah, Mimi covered quite a bit, but maybe just one point from my end. I think to really achieve the consistency and ensuring duty of care, especially across large and decentralized organizations like Catholic Relief Services, we really have to hold our supervisors accountable, and I mean supervisors at all levels, anybody who's in a supervisory position. But to do that, we have to help them have that capacity to support their teams and their staff. And so this should be part of their development. Do our supervisors know, how to support their teams? And are we give them those skills and capacity to do so? And then are we holding them accountable and measuring, performance against how we support our teams and how we ensure their well-being. So I think that's really something that we need to focus on, and we can't assume that every supervisor has those skills, and we have to support them to build those skills. So when people do ask for help, and even better, when we ask people, how can I help you? We can actually be assured that the response and the support, which is not necessarily always financial or has some cost to it, maybe it just costs time or flexibility, that the person, the supervisor, actually feels empowered and supported to support their team members. Thank you.
Thank you.
So I definitely want to join my fellow panelists and excellent facilitator. First on the call out to donors. Actually, the first people to contact me after I came public with my story were donor friends that are also going through stress. So I do think they have a responsibility to support us to do right by the staff. I also feel like they can relate on many levels because, especially during COVID, it affects everyone, right? Just in different ways and different levels of severity. But I do think the way that we deal with stress in our ecosystem is touching all of us. So we need some solidarity here. Second, on the point with regard to managers, supervisors, I heard a lot of people when I did the interviews have a lot of resentment towards their managers because they feel like their managers are putting a lot of responsibilities and aren't giving them the support they need. At the same time, I heard from a lot of managers who said, I don't know what to say. I see that someone on my team is struggling, but I don't know what is appropriate. Give me a script. Or I'm dealing with very limited budget. I have to deliver. So part of my take-home message is this idea of mindset. Can we shift our mindset? That duty of care is an obligation. In a world of resource scarcity, it's not a luxury that's an add-on. No, it's required way of operating. Interaction has done extremely interesting work looking at risk management. And everyone I've interviewed at leadership level, they see this as relevant to all of the core risk factors, to your operational risk, to your fiduciary risk, to your reputational risk, to your ethical risk. It's relevant. So my final message is I have hope. In the run-up to the World Humanitarian Summit, there was a group of humanitarians that started a petition to get aid worker wellness on the agenda. Over 1,000 aid workers signed it. It did not show up in the agenda. It did not even, there was a side session on journalists' well-being, but there wasn't a session on wellness of aid workers. Fast forward to 2021, what we've been through as a sector, as a world community with COVID, but also stark reminders of racial injustice, really heavy tech saturation and how we are working with each other. I think more people are now paying attention. And so my hope is that we can pursue these things in solidarity, knowing that no one has figured it out, but it's too important just to put on the shelf and say, let's just focus on these other things. It's actually really important, and it's an opportunity now that we can actually look at these things together. So thank you so much to my fellow panelists and to my facilitator for having this conversation. It's just yet another example of solidarity that I think we need to see more of in the future.
I think we have our work cut out for us based on what Mimi, Jennifer, and Melissa said. So solidarity and love and gratitude, and thank you very much. You can call this portion complete.